Let us welcome Dr. Shalini Ratan.
Thank you, Anju. I'm grateful to HELP for giving me this opportunity to be part of this gathering and listening to so many enlightening speakers. Now, patient-centric approach. A lot of things have been said about patient-centric approach. And I would say that 50 years back, doctors have given justice to the term family physician. Okay? And a doctor was part of the family, therefore that is the reason the term family physician has come. There was a lot of bonding with the patients, and the patient used to really depend on the doctor for whatever the doctor says it should happen. That little change came in the year 1916 when there was invention of stethoscope. Stethoscope was the first technological advancement which happened, which created a little bit of rift between a doctor and a patient, because the doctor now had depended more on his stethoscope than the inputs given by the patient to him. More than history, it started becoming diagnostic. And in the coming time, with technological advancement happening more and more, there was more and more imbalance between a doctor and a patient relationship. All the more that from patient-centric, it became a disease-centric approach. So now, as in scriptures also it is said, that there is always reinventing of the wheel and history repeats. So from patient-centric, it became disease-centric, but now in coming time, again it has to become patient-centric. Now when a patient comes, a doctor sees a patient as a diseased person. He's in a state of sickness and he is a disorder. This is how a doctor sees a patient. But in reality, the patient comes with illness. Now there is a difference between a disease and illness. Disease is a very objective term. Illness is a very subjective term. A patient does not come only with a disease. He has a lot of baggage of troubles and emotions when he comes to the patient, when he comes to the doctor. But if we treat only a disease, it is like fixing a machine. And if we treat the illness, it is like giving a holistic approach to treat a patient. There is a term called health. WHO says, what is health? Taking care of the emotional, spiritual, physical, and social aspect of a patient. But what we are taking care of, the physical aspect. So why are we called as healthcare providers? Doctor is a good term to be said. If we are called as healthcare professionals, healthcare providers, or healthcare organizations, where is the care and where is the health? It is only absence of disease, nothing more than that. So from where this term healthcare has come? So gradually the term wellness is coming. There are so many terms. Now which term to use where, which is important. So ultimately the bottom line is giving health and wellness. Therefore, more than healthcare organization, it is more of health and wellness industry, which is now we call off. Because wellness, in this state of lifestyle diseases, wellness is one of the important times. So first we have to ask ourselves, are we managing disease or we are managing patients? Majority of the time we focus on the disease, but we forget that the person who has come is a human being. He is a Homo sapien, not a techno sapien. So we need to remember that. This is the 21st century patient. He has many queries. First query, I have a leg pain. Now whether I should go to a rheumatologist, orthopedician or a neurologist, I don't know. Patient does not know the difference between them. He does not know who is a rheumatologist. When he goes to orthopedician, he is told to go to a rheumatologist. When he goes to a rheumatologist, he is told to go to an orthopedician. He does not know about it. So, there are many queries which the patient has. When a doctor is giving insulin to the patient. Now the patient has read somewhere insulin leads to dependence. Now I am not going to take insulin. Patient asks, I got an opportunity to take a session for patients at HELP in the month of September. I had taken a session on understanding of medicine. The type of questions the patients ask. Why I am giving this medication which is so expensive of one company when the same medicine of some other company is half the price? So why the doctor has prescribed this medication which is so expensive? If I have to use an ointment once, why the whole tube is given to me? Such type of questions the patient asks. So this is a 21st century patient who has many questions in his mind. So today's patient is an inquisitive patient, whether it is related to health, disease, care, doctor, clinic, in a hospital. Even going to a hospital, he will just go on the internet, Kokila Ben Hospital. He will go on the internet, who are the doctors on this? This is how the patient look for doctors now. Not only this, even the patient is all evolving as a consumer. A McKinsey study had said that the factors influencing patients' hospital choice, it is only 21% by physician's decision, 18% by location, and 20% by hospital reputation. 41% is patient experience. Now, patient experience is more than a technical outcome. It is not just getting treated. It is also about the emotional well-being, whether our family members or myself is taken care of, how is the staff, whether they are able to speak to us properly or not, what type of gowns we are given to wear, what is the infrastructure of the hospital, what is the cleanliness, whether there is noise reduction or not, all these things, the way a person goes to a hotel and hospitality is given. So if we are calling it as hospital, so why hospital is without hospitality? The term hospital itself says hospitality, so we should have hospitality first in a hospital, then in a 5-star hotel. So it's not only the patient's needs, we also have to take care of the demands of the patients. He is also a patient with illness, and to take care of the demand, we have to see him as a consumer also, then only you are able to make a patient as a loyal customer. The doctors do not like to call them as customers, but in true sense, they are their customer. Either you change or patients will change you, or change will change you. One has to change. So what to do for this? Creating efficiencies through patient engagement. There are various skills which a medical professional requires. Functional skill is after coming out from a medical college, you get the functional skill. Medical knowledge, excellent medical knowledge, examining, diagnosing, prescribing and treating, everything you do. Then comes the mechanical skills. Mechanical skills are the first thing to attract a patient now. They work at the level of the senses. Clinical ambience. A doctor must be having 25 years of experience, but when you go to the clinic, it is the filthiest of the clinic. Inside you are giving a treatment for malaria, but outside the clinic, you are creating malaria for the patients. Okay? Equipments and procedures, marketing, medical practice, information technology. But to make the patient come back to you again, that is the consumer part also. You want the patient to come, you don't want doctor shopping, you want the patient should be a loyal patient. You need to understand the concept of human skills, that is listening and communicating, understanding, caring, educating and treating the patient holistically. Now there is a patient care model which is given, that you have to see the person from a disease point of view, from an illness point of view, find a common background, make a common platform. You are an expert in treating, but the patient is expert in his illness. He knows much better than you about how he feels about the problem, about how he feels about the symptoms. So there is to be an informed decision which needs to be taken by the patient and the doctor. This will enhance the doctor-patient relationship, helps more in prevention, and this is being realistic with the patient. So the new model doctor needs to be a psychologist, an advisor, and a counselor. Even with the smallest of, there is one example, if a patient comes and a medicine is given and he feels dizziness, he calls up the doctor and says, "Doctor, I am feeling dizziness." Now the doctor knows, because the doctor sees so many patients with the same type of disease, he says it's just because of low hemoglobin, and after that, nothing. Now the anxiety increases. Now it is not the problem, it is the anxiety of the patient because of that side effect which is affecting the patient. He calls another doctor. Doctor says, "You get this CBC count done, come tomorrow, let's see together what to be done." Same thing, this is how you communicate and reduce the anxiety. It is not reducing the side effect. It is reducing the anxiety of the patient, which will make the patient come back to you again. So one has to be a psychologist, an advisor, and a counselor to the patient. While modern medicine is aided by a dazzling array of technologies like high-resolution MRI scans and pinpoint DNA analysis, language is still the bedrock of clinical practice. It is said that 78% of patients leave the hospital without understanding their treatment.